This is Carlos Samaniego. Today's November 15th, 2016. Yep, that's Christmas music you hear, and favorite time of the year for me. Anyways, today's training. Let me turn down this music here. Today's training is about open enrollment for Medicare. We still have exactly 21 days for you to pick a Medicare plan for the 2017 year. So we got 21 days, 3 weeks today. What I wanted to cover today is how to pick a Medicare plan. Now, picking a Medicare plan, I'm going to actually cover only a couple of things on picking a Medicare plan. Picking a Medicare plan, there's a lot of decisions you have to make. Right here in front of you, I actually have quite a few of those decisions that you have to make, and I'm going to go into details on a few of these decisions. Some of the decisions you'll have to make is, how much are you willing to pay for premiums, deductibles, doctor visits, hospital stays, which hospitals and healthcare providers that you currently use that are in network. Will your doctor accept the coverage? And if not, are there doctors near me who will accept your coverage? Will I need referrals to visit specialists? Will the plan cover me if I get sick while traveling out of state? What will my prescription drug costs? Are my drugs on the plan's drugs list or formulary? Does the plan include pharmacies I currently use? Can I get my prescriptions through the mail? Does the plan have a good quality rating? Well, what kind of caused this webinar, me wanting to do this training, was an article I recently read in the AARP magazine. You see this article here, it says, sticker shock ahead for some Medicare users. And what this article is talking about, for this upcoming 2017, there's going to be a dramatic difference in terms of the cost for your drugs, depending on which Plan D plan you have, which Medicare Advantage plan you have. And in fact, it's kind of hard to read here when I scanned it. Here's one specific drug, the Advair Discus. And this right here, it's saying there's a price difference anywhere from as low as $21 to over $178. That's a dramatic difference in terms of the cost for the exact same drugs depending on which plan you have. So what I wanted to do is show you one way you can actually find out what will your drugs cost for the upcoming year. This is something I do for my clients. It's something I can do for you. It's something you can do for yourself, and I'm going to show you exactly how you do this. The way you do this, you need to go to Medicare.gov. You type in Medicare.gov in the window here. And then when you get there, you come to the Medicare website. What you want to do is click Find Health and Drug Plans. You're going to click this. When you get there, you're going to enter a zip code. And what I'm going to do, I'm going to enter the zip code of one of my clients. I recently helped him do this. So I'm going to enter his zip code. The next screen here, it's asking specifically what type of Medicare coverage that you have. Do you have original Medicare? Do you have a Medicare health plan? If you don't know, you can click one of the I don't knows. Now, I knew specifically he had a Medicare Advantage plan, but I'm just going to assume he didn't, okay? So, original Medicare. And then down here, the next question, it does ask you, do you get help from Medicare or your state to help pay for your Medicare prescription drug plans? Now, one of the things, if you qualify for low-income subsidy, that's a separate training I will be doing, but in this instance, he did not get any Medicare help for his drugs. Now you're going to come up with this screen, and this is really neat. What you do, you're going to pull off your medicines off your medicine cabinet, and you're going to start typing up the names of your drugs. And I'll give you an example. I'm going to type up one of the names that he gets. Now he gets a Spiriva handhaler. So you would click that, and then next it's going to say, which drugs here, the dosage of the drugs, and there it is. And then I'm going to be able to add this drug. Now you see how it just added the drug. So what you're going to do, you're going to go one after another and enter your drugs. So there's another one. So now it's giving me the options of, is he getting the first one here or the second one? So all you're going to do is keep on doing that until you have all your drugs. Now, I've already typed up all his drugs, and there was a few. So what I'm going to do, I'm going to show you what happens. I'm just going to remove that temporarily here. Once you've actually typed in all your drugs, all you're going to do next, once you typed in your drugs, it will save that information. So I'm going to actually pull up his saved information. I did this. There it is. So when I did this a few weeks ago, it actually saved all the information. I was able to input the drug list ID, and it saves that for you. So here's all the different drugs that this individual takes. Now I'm going to click My Drug List is Complete. Now the next screen here, it actually lets you pick the different pharmacies. So what you're going to want to do is maybe put the pharmacies that you use. I knew specifically he used CVS Pharmacy, so I picked another pharmacy just to get an idea of different pricing. So I did the Rite Aid Pharmacy, and then I'm going to go ahead and continue to plan result. Now the next thing it tells you, we were looking for a Medicare Advantage plan for this specific individual. So right here it tells me Medicare health plans with drug coverage. So I'm going to click this, and I'm going to continue to plan results. Now this is telling me that there are over 31 different plans in his area code that are available to him. So what I'm going to do, because if you just go view 10, it's only going to give you 10 right here. I'm going to go ahead and click view all. Now, once you've done that, it will give you all the different plans, Medicare Advantage plans that are available for this individual. As you can see, it starts from Brand New Day, HealthNet Gold, Alignment, Scan, Anthem Blue Cross. Again, it's giving me, there's 32 different plans here. Now, one of the few things that we're looking at, remember I talked about earlier, there's quite a few different things that you want to look at when picking your plan. And one of those things that you want to think about is obviously, does my doctor that I currently go to accept the plan? So obviously, if they don't accept the plan, I'm not going to look at that plan. Like I know for a fact with this individual, his doctor did not accept Brand New Day. That's just his medical group didn't accept it. So I wouldn't even bother looking at this information. Now, as I'm going down here, what's neat about this is I can get a rough idea of what the cost of these drugs are going to be. Now, typically, mail order is going to be the cheapest place to get your drugs in 90-day supplies. So one of the things I can do over here, you'll notice right here that it will actually highlight what would the cost of his drugs be through mail order. Now I'm looking estimated cost of the drugs: $2,000, $1,800, $1,834, $2,000, $1,096, $2,029. Again, you can see there's a wide variety of different drug costs for him. $5,000, $4,000. Again, you can see these prices are getting higher and higher depending on the plan that he actually picks. So I'm going to scroll right back up here. Now it looks, for his specific situation, that HealthNet would have been the lowest cost for the drug so far. Now I can click here, HealthNet Gold. And then once you've actually picked the plan, I can go look at drug cost coverage, and then it will specifically tell me what the cost of his drugs would be. Again, right down here, if he goes to CVS Pharmacy, it's going to be roughly $74 a month for his drugs. If he goes to Rite Aid, it's going to be about $102 a month for his drugs. And if he gets it through mail order, it tells me the price of his drugs for every 3 months. Now the neat little trick here too, it will also tell you if you're going to go into the donut hole. You'll notice here, if it's in green, that's the initial drug coverage limit. But now, starting in June, you see where it goes red? That means he's actually going into the donut hole. So, again, this is just one of the few ways that you need to consider when picking your Medicare Advantage plan. Now, if you'd like somebody to do this for you, if you'd like myself to actually look up your medicines, you don't use a computer, I'm more than happy to do that. We only got 21 days left here to be able to pick a plan. So what you need to do is you need to give my office a call. My number is 909-570-1103. 909-570-1103. Or you can set up an appointment directly with me at meetwithcarlos.com. Meetwithcarlos.com, and you can just set your appointment with me. Trying to pull up my information right here. Again, here's the information. You can book your appointment with me at meetwithcarlos.com, or feel free to give us a call at my office at 909-570-1103. Talk to you later.